Access, access, united we're strong. We won't go away because we know you're wrong. Access, access, you've had your way too long. We're here and we're gonna stay.
Hi, this is Will Cowing from Adapt to Chicago Productions. We have a very interesting show today. Our guest is Marilyn Martin. Now,
Hi.
you are at Access Living, right?
Yes, I am.
And can you give the audience the exact title?
I'm a health access policy analyst, and because I do have a legal background and actually about 12 years of those, of my years spent practicing law, it did involve disability issues. I tend to do a little more in the area of laws and regulations.
Okay, Karen, give us an example of what you do now, where it affects one particular disabled person.
Well, it would affect one individual, but in a sense, policy sees a little bit of the bigger picture in terms of the whole system. And I'll give you an example of that. We had a research grant to do research on the kinds of barriers that people with different kinds of disabilities experience getting quality health care. And we did this through focus groups. We had people with mobility disabilities, people who were blind and had low vision, people who were deaf or hard of hearing, people with mental health issues. And we devoted each of those focus group sessions to the particular kinds of barriers that those individuals experienced. And
now,
then,
I understand you're going to have a guest you're going to bring on the...
yes, I'm very, very pleased that Michael Grice will be here to talk about his experience as a person with a mobility disability.
Okay.
But an example of how policy comes out of that is that we take those lived experiences of our consumers as they've related them to us, and these statements that our consumers made were just invaluable. They were so important and so significant in providing comments to the Department of Health and Human Services. They had asked for comments on how to make meaningful a provision in the Affordable Care Act, which some people call Obamacare,
Yeah.
that prohibits discrimination on the basis of disability.
Okay, now how would that work in the case of a blind person, for example?
Well, for example, we gave illustrations of what our consumers were encountering. Now, we had one individual who talked about the fact that rather than communicate with him verbally, which of course was necessary because they couldn't give him written materials. I don't think they even had materials in Braille. So they would, to give him instructions about his medications or about follow-up and treatment and so on, they'd come out in the waiting room and just talk to him publicly in the waiting room about his private medical matters, which of course is a violation of HIPAA. It's a violation of a lot of things, both ethically and legally.
Well, that has been the subject of humor sometimes, but it's really not funny.
No, it's not at all funny if you're the person who's blind and
Right.
you're being treated that way. So what we wanted to do was give illustrations like that, very specific illustrations, to the Department of Health and Human Services so that when they decide what they're going to do in terms of regulations or guidelines or standards, they can speak directly to that kind of experience. And we did this with all of our, the full cross-section of our consumers.
So in the case of deaf people, there would be a signer present that would sign
Well,
or it should be.
There should be.
Yeah.
There should be. Legally, they're supposed to be. But we had one instance of a man who had become ill at work. He was taken to a clinic. This is a man who's deaf. Never had an interpreter provided there. They took him to the emergency room, no interpreter. From the emergency room, he was taken to emergency cardiac surgery. He had open heart surgery no interpreter. He was in the hospital for 8 days. He had an interpreter on the last day.
Oh my gosh.
So he had to endure that whole experience without a clear understanding of what was happening to him, what the diagnosis was, how they were going to treat him, what kind of surgery was involved, what the risks were, and so on. So this is a particularly, I think, egregious example. And we certainly want the Department of Health and Human Services to be aware that when interpreters are not provided for deaf people, they can have really horrific experiences like this.
Oh. Now what are some of the other, like
Well,
people in chairs, for example? We're going to
Yeah,
talk with Michael about people.
Yes, we are, and I think Michael's going to give us a lot of detailed information about his experiences and what it is like to try to be examined and weighed and so on. Another group that we talked to were people with mental health issues. And again, the stigma of mental illness is such that even people that you would think would know better, for people in healthcare, doctors, nurses, and so on, even those individuals were creating issues for people with mental illness. Very frequently, our consumers with mental illness said they were not believed. That they would go in and relate their physical symptoms, and the doctors would attribute it to mental illness, that these were just delusions or hallucinations, I don't know what. So this is a common occurrence for people with mental illness.
Wasn't this the case with women often in the turn of the century, that a lot of women, they're hysterical?
There was hysteria, exactly. And unfortunately, similar attitudes are still prevalent today with people with mental illness.
Well, I remember going to a political meeting that Adlai Stevenson, who was a man I admired, opened with a joke about the governor visiting a mental illness facility. I'm not going to tell the joke, but it got a big laugh. And I'm thinking later on, maybe he should not have told that.
Maybe not. Yeah, we do hope that nowadays people will become more and more aware of etiquette around disability issues.
Right. Well, we're going to move on to the next segment now, but we'd like to keep this going later on and have
Sure.
more conversations on this subject.
Okay.
All right, very good. Now we'll move on to our next segment, have Michael come on.
Good.
All right,
Okay.
Thank you.
Thank you. Well, I'm very pleased today to be talking with Michael Grice. Michael and I are going to talk a little bit today about healthcare and the experience of people with mobility disabilities in getting good health care. So Michael, when you go to the doctor for either a routine exam or any particular reason, what is your experience in terms of getting weighed? Getting weighed is kind of an ordinary part of an examination.
Well, actually, that doesn't happen because most medical facilities don't have a wheelchair scale that people with disabilities can use.
Well, we know that there are such things. Have you ever had any experience with an accessible wheelchair scale?
I've had a couple experiences, but those haven't been positive experiences.
Yeah. So how do the doctors determine your weight then? Weight is important for both diagnosing things and for giving proper medication doses.
Well, generally what happens there is I just throw out a number and my physicians go with that number.
So they're just asking you to estimate your weight.
Yes, I'm often asked to estimate.
Okay, well that's certainly not a proper medical procedure, and we hope that more and more offices will use accessible weight scales so that people can be weighed properly. Now, what about the examination itself? Most people, of course, get up on an examination table. How are you examined?
Well, most of my exams are done in my wheelchair because the examining tables are not accessible.
Well, again, just like the weight scale issue, there are accessible examination tables that can be lowered to the level of your wheelchair so that you can transfer. Have you ever once encountered an accessible examination table in a doctor's office?
No, I have not.
Okay, well, again, we hope that more and more offices will install those, particularly since those examination tables are becoming more commonly available.
What do you have to do if you're a doctor, what do you have to do to get one of those tables?
Well, you just order one from the manufacturer, but of course a lot of doctors are concerned about having to install new equipment and so on. So now I will say that the United States Access Board is about to announce new standards for accessible diagnostic medical equipment, and if the Department of Justice takes action on those standards and makes them binding regulations, then doctors' offices won't have a choice. They will have to have these pieces of equipment available.
Good.
Another issue. Now, do you usually take someone with you to the doctor's office?
I'm glad you asked that question because most physicians that I see think that I travel with a personal care assistant to my medical appointments, which I do not travel with a personal care assistant. And under the law, I'm not required to travel or bring a personal care assistant to my appointment.
No, you're absolutely right about that. I mean, the Department of Justice guidelines to the Americans with Disabilities Act expressly states you're entitled to bring someone if you want. You could bring a family member, a friend, a PA, but you're not obligated to do that. Now, do you think that these medical personnel think that you're legally required, or that it's just a matter of convenience? What do you think motivates them to tell you that?
I think that they think legally people with disabilities are required to bring a personal care assistant with them at all medical appointments.
Well, I think we're going to have to do some educating of medical personnel then, because the Americans with Disabilities Act says people with disabilities are entitled to health care that is equal in quality to the health care that everyone else receives.
So you don't have to bring an attendant, right? Absolutely not.
Right, you don't have to. You have the option to bring one if you choose to.
Now, have you ever had an experience where you have not brought someone with you and that has somehow interfered with you getting proper health care?
Oh yes, that's happened on several occasions. I have, I've asked nurses and other medical professionals, I've told them that I need assistance in getting up on the examining table, and they've looked at me like I was crazy.
And then, so what happens? Do you get examined, or?
They they say that, they can't do it, I should have brought my personal care assistant for the lifting purposes.
And then they just examine you a little bit in your chair?
They just examine me in my chair, period. It doesn't go any further than that.
That's not a complete exam then, is it?
Right. And what it does, it really affects your weight and it affects your medications if you have to take certain medications. And a lot of my medications have been changed a lot. So that makes my weight fluctuate. It goes up and down from month to month.
And
I cannot give my physician an exact number of what I weigh. I always have to estimate, and that's not a good thing to do.
no, it's not a good thing. And that's, again, a very dramatic illustration of why we need to have weight or accessible weight scales in doctors' offices. There's no way a doctor can prescribe the proper amount of medication without knowing an accurate weight. So that's a very risky procedure to just have you guess your weight. Now, in terms of getting on a table, have you ever had assistance getting on an examination table by medical staff or other people in a medical office?
I haven't. That's been like pulling needles out of a haystack.
Oh, ooh. Wow,
Ouch.
that's something.
Because there are professionals, believe it or not, that work in medical facilities that don't know how to work a Hoyer lift properly.
Can you explain a little bit what a Hoyer lift is?
A Hoyer lift is where a pad is put up under you and you basically have to have an able-bodied person connect the straps to the Hoyer lift. And once the straps are connected, you have to pump the Hoyer lift by hand, or there are Hoyer lifts that are automatic, where you push a button and it goes up and down. But again, there are a lot of professionals to this very day that still don't know how to use a Hoyer lift properly.
And if there were a Hoyer lift in a doctor's office, they could use that mechanical way of getting you properly up on the examination table, right?
Yes, but the other factor with that is the examining tables have to be accessible for people with disabilities that have muscle spasms. And when a person has muscle spasms, that means their arms shake or their legs. So if the table isn't made properly, they could have a muscle spasm and roll off the table.
Well,
Ooh.
yeah.
Do you know anybody that's actually happened to, or did it happen?
I do know some individuals that got hurt in that manner, yes.
Another way that doctors can manage muscle spasms is by proper positioning on a table, correct? With cushions or supports?
Yes, that's true.
So again, go ahead.
But then we get into the position of those tables cost too much money. Those examining tables cost too much money, and how frequently are they going to be used?
Well, I mean, a doctor's office could simply have one table available simply to use
Yes.
when a person with a mobility disability comes in. That's really what the Americans with Disabilities Act should require. And of course, again, we hope that the Justice Department enacts some regulations so that this will become binding on doctors' offices. What do you think should be done in terms of training people to how to work with people with mobility disabilities in doctors' offices?
Well, we need to train them while they're in school. Not wait until they're out of school and working in a medical facility. The disabled community actually needs to train residents, nurses, PTs, OTs in the very beginning of the process. But that's not happening right now like it should.
Is there any hospitals or any medical schools that are doing this now?
One in particular in the western suburbs has just started to actually do the training, because they're working with a particular organization in that service area that works with people with disabilities.
Another very beginning training program is something that Access Living has been involved with as well. Another medical school has started a program where entering medical students come to Access Living for a couple of hours just to get acquainted with disability issues, with people with different types of disabilities, and how that affects healthcare. So that's another encouraging step in the right direction. So Michael, are there other aspects of your healthcare that we can talk about today to help people understand what you encounter?
Yes, people in a lot of communities assume just because an entryway to a building has a automatic button, they assume that the building is accessible after that. But I've been to a lot of medical facilities where there are major accessibility issues. And I'll just point out one. Are the restrooms. There are different size mobility devices. And I know that a lot of my other colleagues have a lot of accessibility issues with the bathrooms and being able to maybe access the pharmacy.
So if they, for example, in a hospital, if a patient with a mobility disability cannot make use of the restroom, they lose a lot of privacy rights, don't they?
Yes.
So that's one more way that it's unfair to be in that position.
Right.
Now, have you been in doctor's offices where the rooms, the examining rooms, are not large enough for you to get in with your chair?
I was just at a medical facility like three weeks ago where I had to literally squeeze my way into the examining room because the doorway of the room was not really accessible.
And were you able finally to at least get in, or what, would you
I
just have
was
to go
able
home?
to get in, but it was very difficult.
So you got an examination, but not easily,
Not easily, no.
right?
Well, it's running out of time now on this interview, so if you want to ask him a final question.
Is there anything you'd like to add, just as a final comment?
I would hope at some point that the feds would really take a closer look at a lot of these accessibility issues and put out some standards that could be followed.
Well, we at Access Living hope so too, and we're working on that very hard.
Very good job. Thank you. Thank you.
Yes, thank you, Mike.
Thank you.
I want choices and right. Choices and right. Choices and right in my life. I don't want your charity or you to be paid to care for me. I want choices and rights in my life. And I don't want to be in your care or to be put someplace out there. I want choices and rights in my life. Choices and rights, that's where we gotta find choices and rights in my life.